Welcome to 6ABC's Weekend Extra, paid for by Mainline Health. Here's Jessica Boynton.
We're here today with Dr. Lawrence Livornese Jr., Chairman of Medicine and Infectious Disease Specialist at Mainline Health. He's going to explain how life may change as people get vaccinated and guidance on continued vigilance to help stop the spread of COVID-19. Dr. Livornese, welcome. Thank you so much for joining us today.
Thanks for having me back. It's nice to see you.
You too. Now, we were together in the beginning of the pandemic talking about all of this, but now we're 6 months into vaccinations in the United States. What have we learned about the vaccine?
Well, I think there's some things we're sure of about the vaccine and some things we're still learning. We know that the two current vaccines that are being administered, the Pfizer vaccine and the Moderna vaccine, are highly effective in preventing infection and do very well in avoiding people being hospitalized or dying from COVID-19. We also know that they're extremely safe and can be given to a wide range of people without problems.
All right, so what does safe travel look like at this time?
So the way to think about travel is to really break it up into two parts. There's domestic travel within the United States. And I think for people who are vaccinated, they can really travel within the United States without any difficulty or any precautions beyond the things they're already doing, such as wearing masks and socially distancing. For those who are not vaccinated, the recommendation is that they're actually tested for COVID before they travel, and following travel, either quarantine themselves for 10 days or have a COVID test at about 5 days after travel. And if negative, they can come out of their quarantine at 7 days.
Now, a lot of the discussions have been about the children staying home from school and not really having a lot of things to do. What about summer camp for kids? Is that safe?
So the CDC has actually done a lot of work on this, and their website has a lot of information about how kids can safely go back to summer camp under certain protocols. Children who stay in smaller groups, who don't intermingle with a larger population during the day are safer. They still need to socially distance, use masks, need to avoid sharing common objects, need to have protocols in place to allow kids who are sick not to go to camp and infect others. They're all kind of common sense strategies that we'd all would recognize. And we think children can go back to camp safely under those circumstances.
Yeah, so I mean, transitioning right from summer camp where kids are playing outdoors to adults dining indoors. Now, people are dining indoors right now. How can they continue to do this and do it safely?
Well, I think first we have to recognize being indoors with masks off is a risk. And so if you're going to dine, I think you need to think about a couple of different things. First of all, is the number of people that are actually in the room with you, and also what the ventilation in that room is. If you're in a tight, closed space without ventilation, you have your mask off and you're eating and talking, there's a real risk of transmission. If you can go to a venue where you're more spread out, where there's good ventilation, you could dine reasonably safely, particularly if you know the people in your immediate vicinity that you're dining with have been vaccinated. Certainly sitting across the table for an extended period of time with an unvaccinated person while you're eating and talking is going to put you at risk.
Right. So what steps can people take to continue to stay vigilant about preventing some of this disease spread?
You and I met a year ago when we talked about this, and it really has not changed. I guess we'll add to the list now. Number one, please think carefully about getting vaccinated. I think it's an important and critical individual decision. I would urge people to educate themselves about the vaccine and recognize that you're not just protecting yourself when you're vaccinated, you're protecting your friends and your family and the community around you. But in addition to that, wearing a mask, socially distancing, and frequent hand washing, all still very important issues.
Yeah, you know what? Even if we've heard it before, it's always great to have a refresher. Dr. Livornese, thanks so much for joining us today.
My pleasure. Thanks for having me again.
Yeah, 6ABC and Mainline Health are proud partners of Well Ahead Philly. You can visit wellaheadphilly.com for more health tips and information. Thanks so much for watching. Have a great weekend.
Well Ahead Philly helps you gain access to the information you need to feel better and live well every day. Thanks for watching 6ABC's Weekend Extra, paid for by Mainline Health.